Hi, my name is Olivia Kim-McManus. I'm a principal investigator and associate professor of neurosciences at UC San Diego and a pediatric neurologist and epileptologist at Rady Children's Health. The developmental epileptic encephalopathies, or the DEE, are a group of disorders that are characterized by developmental delay or regression in infants and children, as well as seizures that are often early onset around the time of infancy or early childhood and often hard to control. SCN2A is one of the genes that is associated with this DEE symptoms that can affect children and infants very early onset. SCN2A stands for sodium channel. So sodium channels are one of the main components of brain communication. And so a change or a variant in your DNA that affects that channel, like SCN2A, can present with developmental delay and regression and seizures in children like that. Anti-seizure medications currently, and there's a slew of them with different mechanisms. They're anti-seizure medications you traditionally think of as oral medications. They're already FDA approved, and they're not usually targeted for a specific gene or a specific variant, although it can be for class in terms of a type of approach. This is different in terms of a genetic therapy or gene therapy in that it's targeted towards actual um, change in the DNA specific to an individual or individual disease um, presentation and targeting that at the root level of expression to modify protein expression of how your DNA is expressed. So there's a difference in level there, and it's precision or personalized medicine because the therapeutic is designed against an individual variant. Yeah, I mean, these children that we went into N of one trials for were older children. One was around 10 at beginning of study, and the other was closer to almost 15. And so and both had changes in development and cognition in multiple different ways. Their phenotype or their presenting symptoms are different, and it indicates to you that a diagnosis of a single gene can have variations in how it presents. But they both had, changes in improvement in attention. And one significant impact for one of the patients, the older one, is that he was non-ambulatory his whole life and began walking after starting this therapeutic and, has had sustained independent gait at 15 years of age. And so that really speaks to where are the critical windows of development. Of course, earlier you would think theoretically is better in terms of optimizing an infant or child's developmental potentials, but also teaching us that there is potential for continued improvement or intervention in later stages. Yeah, that was the one patient, it was his dosing interval was amended as an FDA amendment to shorten the dosing period. Again, we're in a investigational trial, so we're sticking into the windows that are preset in our IND with the FDA, but at the third month before the next dose, I was seeing decrease in independent gait, no longer ambulating independently for the last few weeks with more of a recurrence of seizures. And based on that, and it was sustained over multiple time intervals like that to see that that was the only change happening. And so based on that, that was something we did send to the FDA as an amendment for shorter dosing intervals. And he's had sustained independent gait as well as improved seizure control now for at the every 2 month dosing interval. And it does tell you that, can you personalize somebody's therapeutic regimen that is optimized further for one individual? You can. Of course, this is in a regulatory space with an investigational. So there's many layers to that, though, what we could do on for a child, with existing therapeutics too, and really tailoring care. I mean, don't want to end up the single patients, right? We started this because we're an ultra rare space or rare disease space, but the fact that we're seeing safety and efficacy in these two, that we want to see potential impact for more children, including with SCN2A related disorders, as well as other monogenic neurologic conditions where this type of genetic intervention is feasible. So we want to continue to see that impact and how it changes treatment paradigms for infants and children.